Hello friends, back with another session here. Pott's disease. Pott's disease is also known as tuberculosis of spine or cod spine or Pott spine. Common site of bone and joint TB is spine, and in spine the dorsolumbar region is frequently involved. It is always secondary to pulmonary TB and spread via hematogenous route through Batson plexus. Types: paradiscal, central, anterior and posterior. Four types are there. In paradiscal is the commonest one and posterior is least common. In paradiscal, the contiguous areas of two adjacent vertebrae and intervening disc are involved. In central, body of single vertebrae is involved, leading to early collapse and thus wedging. In anterior, the anterior part of vertebral body is involved and infection spread up and down along the anterior longitudinal ligament. In posterior, pedicle, laminar, spinous process and transverse processes are involved. Now coming to pathology. As most common is paradiscal, so bacteria lodge in between the two vertebrae, contiguous areas between the two vertebrae, and there it causes granulomatous inflammation leading to erosion of margins, thus nutrition compromise and disc degeneration occur and leads to complete destruction of the vertebrae and also weakening of trabeculae, collapse of vertebrae, and thus wedging will be there. And this granulomatous inflammation causes pus to collect. Pus collection is known as cold abscess, and if cold abscess goes backward, it can compress neural structures of spinal cord. If anteriorly, prevertebral abscess; on sides, paravertebral abscess. Now coming to clinical features. First is pain. In early cases, pain is diffuse. In late cases, it is localized or radicular pain depending on which root is involved. Like if cervical root is involved, arm pain will be there, dorsal root, girdle pain, lumbar root, pain abdomen, lumbar root, groin pain, and lumbosacral is sciatic pain. The second symptom is your stiffness. So stiffness seen very early in the cases of Pott spine, and it is usually to protect affected vertebrae. Paravertebral muscle spasm occur. Cold abscess presented at swelling leads to dysphagia. Paraplegia as a complication. Deformity, gibbous or kyphus or constitutional symptom, fever, weight loss, night sweats, anorexia. Now examination. When the patient arrives to you, first you have to examine gait of patient. Short steps. To avoid jerking of spine, patient is walking with short steps and supporting his head with both hands under chin and twist to look sideways. Attitude and deformity. If cervical spine is involved, stiff and straight neck will be there, and dorsal spine, gibbous and kyphus. If lumbar spine, loss of lumbar lordosis can be there. Paravertebral swelling, superficial cold abscess presented with fullness or swelling on the back, along chest wall or anteriorly. Now tenderness, elicited by pressing upon side of spinous process. General examination, active or healed primary lesions or any systemic illness can be observed like diabetes. Neurological examination, motor, sensory and reflexes are examined. Now coming to investigations. In investigations, first of all, you have to do X-ray. X-ray will reveal reduction of disc space, destruction of vertebral body, evidence of cold abscess, either widened mediastinum or paravertebral abscess or retropharyngeal abscess, rarefactions, and aneurysmal sign of healing. Area surrounding lytic lesion shows sclerosis. CT scan. Beside X-ray, you have to do CT scan. Useful investigation for STS, that is spinal tumor syndrome. MRI, investigation of choice to know type and extent of compression of Pott. Myelography, biopsy, and other includes ASR, Montex test, or ELISA. Now treatment. First, you will give rest to a patient. For pain relief, short period of rest is required. But if significant vertebral destruction is there, patient need long period of rest. And in case of child, you have to give body cast to force the child to be in rest. Now rest is followed by guarded mobilization. When patient improve, spine supported, collar for cervical spine, ash brace, dorsolumbar spine. Now after rest, you have to treat cold abscess, either aspiration, thick needle because thick gaseous secretions are there, evacuation, wall curated and wound closed without a drain, and also ATT can be provided to a patient as this is a case of TB. Thank you.